There are 6 key benefits for service providers when they apply person-centered values. Firstly, it provides clear guidelines for the standards of care that should be given. For example, a care home adopts person-centered values to have clear guidelines focused on individualized care, ensuring that care workers understand their responsibilities. For instance, each resident's care plan is tailored to their personal preferences, health conditions, and lifestyle, making it easier for staff to know how to meet their needs effectively. As you can see, when service providers follow person-centered values, they will have clear, organized set of standards to follow. This helps them to understand how to provide care, meet each person's specific needs, and reduce mistakes and misunderstandings, fostering confidence among staff as they know what is expected of them. Secondly, it improves their job satisfaction. For example, a nurse in a hospital who practices person-centered care will see the positive impact of their efforts on the patient's well-being. For instance, they may notice a patient becoming more engaged and happier due to their involvement in decision-making. When service users express this, it can lead to a sense of fulfillment and achievement. This makes their job more rewarding, reduces stress, and creates a more positive work environment. Thirdly, it maintains or improves their quality of life. For instance, a care worker in a care home supporting a person with disabilities can enhance the service user's quality of life by respecting their daily routines, assisting with hobbies, and encouraging participation in social activities. By doing this, service providers can observe the positive outcomes of their work. This is because person-centered care often enhances service users' overall well-being physically, intellectually, emotionally, and socially. Seeing these improvements gives providers a sense of achievement, boosts their pride in their work, and motivates them to keep delivering high-quality care while reinforcing their sense of purpose. Fourth, it supports rights to choice and consultation. As an illustration, in a GP practice, doctors and nurses work with patients to make informed decisions about their treatment options, respecting patients' choices and offering alternatives. For instance, a patient with diabetes is given options for lifestyle changes as well as medical interventions which they can select based on personal preference. By doing so, providers are able to develop strong trust-based relationships with patients as they feel respected and empowered. This enhances the provider's communication and advocacy skills, making them better equipped for future cases and more effective in their role. Fifth, it supports service practitioners to develop their skills. For example, in a care home agency, staff are trained on the principles of person-centered care, including active listening and individualized care planning. This training helps practitioners adapt their communication style and tailor their methods to meet different service users' needs. This allows service providers to grow professionally as they gain valuable skills in empathy, adaptability, and individualized care planning. Not only this improves their current practice, but also enhances their career outcomes and confidence in handling diverse care scenarios. Sixth, it enables the sharing of good practice. For example, a nursing home team holds regular meetings to discuss successful approaches to person-centered care. For instance, the nurse might share a technique for calming patients with dementia by using familiar music or sensory objects. These methods are then adopted by other team members, benefiting the patients more. Through sharing strategies and successful approaches, staff learn from each other and improve the overall standard of care. This enhances teamwork, learning, and improvement, which ultimately benefits both service providers and service users.